This is ultrasound of the subseptate uterus. This is, you see, uterus, all of this. Total, this is all uterus. Now, the cervix, vagina is single, the cervix is single, and there are two cavities seen within the single uterus. And this is the subseptate uterus because no indentation is seen between at the fundal region. Because if there had been an indentation, then this would have been a bicoordinate uterus. Now there are two pregnancies, gestational sac seen. One, this one is a gestational sac with double decidual erection. Double decidual erection is the thick echogenic ring around the gestational sac, and the other one is this one. This is the gestational sac number 2 with thick echogenic ring around, which is the double decidual erection or the trophoblastic reaction. This is the fetal head, and whereas this sac is empty. So there are two endometrial canals, and in this endometrial canal there was also a pregnancy that is resolving now. Now this is a resolving twin. It has resolved completely in this endometrial canal, whereas in the second one we see the fetal head, and as we perform the pregnancy, as we perform the ultrasound, you will see that one sac is empty and one sac has a fetus which is active and normal alive. Now the width of the uterus is 11 point. The width of the uterus measures 11.4 centimeters, and because of the reason that there are two areas, gestational sac, that's one, and this is the second one. The one closer to the cervix is considered as gestational sac number 1. The one away from the cervix is considered as gestational sac fetus number 2 as a rule. So these are the two gestational sacs within a single uterus, which is subseptate. I have uploaded a few segments of subseptate uterus as well as bicoordinate uterus. If you study those, you will come across these things very clearly. Now see, this is the myometrium. This area is the myometrium. This one. Single cervix is important to note. Single vagina is important to note. This is not a double uterus. This is a subseptate uterus, separated, and both are separated. So this is a case of intrauterine pregnancy in a subseptate uterus with a resolving twin in one of the endometrial canals, whereas the other one is normal. Now let's see on the real time. There you see. This is the sac number, say, sac number 1. Gestational sac. You can see this is the urinary. This is the urinary bladder. And these two are the gestational sac. This is one, this is the second. And see that the upper wall of the uterus is straight, myometrium is obtained. So this being a resolving twin, we will now study this one, the fetus in the other cavity. This is the fetus. presentation is compelling. This is the head of the fetus, and the brighter diameter is consistent with 14 weeks pregnancy. BPD measures 2.4. You can see the activity in the fetus is seen, and we can see the cardiac flicker as well. You see, this is the cardiac flicker with these waveforms. And now see the movement of the fetus. Here I am not moving the probe, and you can see the fetal movements are present. This is the femur. This is the femur, corresponding to 13 weeks gestational age. Transversection is impossible at this age. Here, this is the nuchal transferency from where we take at this gestational age, which rules out any possibility of Down syndrome, though the position is such that that of the fetus is such that I am trying to get the this fetus is normal anyway. This is the vertebral column. Now you see this central. This is so we don't see any gross anomaly in this fetus. This fetus is normal. It is 13 weeks pregnancy, 13 weeks 6 days, normal intact gestational sacs surrounded by double residual reaction, and the second sac being empty, and there is single area. Now this is again a review of the fact that this is the uterus, the myometrium. This all is the single uterus with two endometrial canals. One is empty, it has an empty gestational sac. This is suggestive of resolving twin, with the second differential being more an embryonic pregnancy in the sac, that will only be of academic interest. Now there is a second sac with the fetus of 13 weeks 6 days. So this is a 13 weeks 6 days pregnancy in this is a resolving twin in the gestational sac, and this is the fetus in the gestational sac number 2. So this is a 13-week gestational. This is a 13 weeks pregnancy with a single cervix and single vagina. Thank you. Now this is the study, same patient showing gestational sac. This is a subseptate uterus. This is the uterus. This is the uterus with gestational sac with intact fetus of 13 weeks in one endometrial canal, and the second one is showing no fetal hole and is empty, is either blightened ovum or a resolving twin. Now there is a third one. This is the third gestational sac, and here you see there is fluid from in the right at the next time. I will show you. It is traveling in the along the anterior abdominal wall. First, let us see the third sac. These are the two you are seeing on your right side, and here you see in the region of the right head nexa. Here comes a third one. Well, this sac, I am giving full sweep to the probe, and it does not change its shape. This is the sac. This is the sac. Alongside this one with the live active 13 weeks fetus, there is another one. This is the third one. This area. So this is the third sac with with decidual erection, but not intact. I am now going to keep your concentration on this area. I am going to give a sweep to see if it changes its shape or not. It does not change its shape. This is the third sac, and it has a broken ecogenic ring around it with blue seen posterior to it. Now this is the third sac. Now this is an ectopic pregnancy in the right tube that has, this is the third one. So these are triplets in fact. Concentrate again on this sac. I am going to give a 90 degrees sweep to this area to see if it changes its shape or not. It does not. It maintains its shape. And it is empty. That is the process. Here it is. With a ecogenic ring around it, but not regular, as regular as we see. You are seeing in the other portion. Patient is extremely tender to this region, in this region. So this is the third sac, and with broken ecogenic ring. It's not, see this double residual erection. Even ecogenic of same thickness, same ecogenicity. But in this case, this is the sac, this internal area is the sac, and this is the broken, this is the ring, and the sac is irregular in outline, deformed, decayed. So, and now from this sac, you will see fluid along the now remember, this is the third sac with ecogenic ring, as this is the second one with fetus. This is the third one. And from here, you see this is the fluid now behind the anterior abdominal wall, posterior to the abdominal wall, and travels all the way into the pituitary angle. This is the fluid. This is the right kidney. This is the margin of the liver. This is the fluid. So fluid is seen in the hepatorenal angle. This is the gallbladder. Fluid is seen. It is in fact bleak. So here you are. This is the portion of the right kidney. This is the liver. This is the boundary of the liver, gallbladder, bowel, and this all of the black area that you are seeing is the bleed. So this is the Morrison's pouch. Moreover, you see fluid in the left side as well. This is the spleen, this is the kidney, part of the left kidney, and this is fluid really goes. This is the fluid. So in splenorenal angle, you also see fluid in the splenorenal angle. And in this fluid, you see no echoes. These echoes are suggestive of bleed. And when you come downwards, here we are. This is now you are seeing the fluid in the pelvic-peritoneal cavity. These are the two sacs in the intrauterine sacs, and here is this is the third sac, and rest you saw was the fluid in the hepatorenal angle. And here you can see fluid in the left Morrison's pouch. This is the left Morrison's pouch. And see the fluid. This is the left source muscle. This is the left source muscle. This is the fluid. These are bowels. So there is fluid in the left paracortical as well. So this is a case study, an interesting one, that of a triplet with the triplet in a subseptate uterus. This is the subseptate uterus myometrium with intact 13 weeks pregnancy in one gestational in one endometrial canal, with the second one showing a gestational sac of 24 millimeters or rather 25 millimeters with no fetal core and is suggestive of either a blightened ovum or a resolving twin or an missed abortion in this case. Whereas we saw the third sac that was deformed, D-shaped, and had a broken ecogenic rim with fluid that was seen traveling from the pelvic cavity around the anterior abdominal wall into the pectoral angle, Morrison's pouch, as well as in the where you are seeing in this left parabolic gutter. So this is a very interesting case, a difficult case, and the uterus has single cervix and vagina. So this is a case of ruptured ectopic pregnancy with a subseptate uterus having an intact 13 weeks pregnancy in one horn, and in the second horn there is a gestational sac seen with that is empty and is suggestive of either a missed abortion. Number two, being measuring 25 millimeters, it is either a blightened ovum or third differential would be a resolving twin. So this is the case of the day.